Hello and welcome to the Health and Justice Forum. Global Justice is pleased to present to you this video conference that focuses on the timely and important issues of COVID-19, global pandemics, and public health. I'm Sosamma Samuel-Burnett, founder and president of Global Justice. Throughout this session, we'll be featuring expert panelists who come from advocacy and policy, as well as health, to speak into these particular issues and provide their insights and perspectives. This is a live broadcast, so we want to take the opportunity to welcome our live audience. Throughout the broadcast, you have a chance to engage with us by selecting comments and questions from the question box and being able to share throughout the broadcast. We'll respond to your questions and comments as we have time and context in this broadcast. Thank you again for joining us. We also have throughout this broadcast an opportunity for you to learn more about opportunities at Global Justice. You can check those out at www.globaljusticeonline.org. After this broadcast, we'll be sharing a video recording as well as related information, so please check that out. For those of you who are just joining us, this is the Health and Justice Forum, and we welcome you to it. And now we'd like to take the opportunity to introduce our panelists. I'll start with Dr. Chris Palkowski. Dr. Chris Palkowski serves previously as the physician-in-chief for Kaiser Permanente at the Revel Medical Center. He also has served on the board of the Permanente Health Group, including as chair of the board. We are grateful to have him here from Roseville, California. Welcome, Dr. Chris Palkowski.
Thanks, Sosamma. It's great to be here.
We also have with us Jeff Fritz. Jeff serves as the CEO of Revel Health. He has been an entrepreneur and innovator in health and technology, and we're grateful to have him with us from Minneapolis, Minnesota. Welcome, Jeff.
Thanks, Sosamma. Great to be here.
In addition, we have with us Dr. Douglas Jackson. Dr. Jackson is the CEO of Project C.U.R.E, a leading nonprofit organization providing medical supplies worldwide. We're grateful to have him here speaking into this issue. Welcome, Doug Jackson from Denver, Colorado.
Thank you. Thanks for having me.
And finally, we have with us Arick Wierson. Arick is a renowned media and business personality who has also founded the Manova Global Health Summit. We look forward to hearing his insights from Minneapolis, Minnesota as well. Arick Wierson, thank you for being with us.
Nice to be here.
So now that we have some initial introductions, I want to share with our audience that obviously COVID-19 and global pandemics and public health have been front and center in the national and international dialogue. Everyone in some way, shape, or form has been affected by this particular concern. So we're going to look at this concern from a lot of different vantage points. But before we do that, we also want you to understand where our panelists come from. They represent diverse backgrounds and diverse interests and experiences, and we'd like you to know more about them to understand how they are viewing and addressing these particular issues. So I'm going to start actually with Dr. Palkowski. Would you share a little bit about your background, how you got into this world and the work that you do?
So as you mentioned, I'm a retired physician, retired just about a year ago. My career spanned over 30 years. I spent the first 5 years practicing in a rural environment in Humboldt County for 5 years. Then I moved to Kaiser Permanente and the Permanente Medical Group, where I spent the bulk of my career over 25 years. Served in a variety. I'm a general internist. I'm a primary care physician and maintained a practice during the course of my career, but had a lot of different leadership roles. And for the last 14 years, I served as the physician-in-chief of the Kaiser Permanente Roseville Medical Center, where I was providing oversight of both inpatient and outpatient services to over 300,000 people. We had over 1,000 doctors and about 3,000 staff. And then I served on the Permanente Medical Group's board of directors for about 20 years. And for the last 4, I was the board chair. So I've had a variety of wonderful leadership opportunities and had a chance to see healthcare from a very unique perspective within the Kaiser Permanente organization.
Great, thank you so much. And that really is a helpful perspective on what you'll be sharing today. Jeff Fritz, I'm going to have you share also. Here you are, an entrepreneur and innovator, but how did you get into health and what is your story?
Yeah, I kind of backed into health, I guess. I started with some technology solutions that were around how people do health savings accounts when they were kind of new in the country, and then started to learn more and more about healthcare, and that became a really interesting place to leverage technology at scale for large both payer organizations like Chris is just talking about, as well as or provider organizations like Chris was talking about, as well as payer organizations such as insurance companies or the government, Medicare, Medicaid. It's been an awesome journey. I feel very fortunate to be able to work in this field. I currently work on a project called Revel, and Revel is a company that's mission is to make the world a healthier place. So it couldn't align more with what this conversation is today. So thanks again for having me here.
Great, and thank you so much for sharing your insights today. Doug Jackson, Project C.U.R.E. is a remarkable organization. Tell us a little bit about that and your background. How did you end up in this, tremendous area of health?
Well, Jeff and I share the notion that you can back into health. I certainly did. My background, I'm an attorney and practiced for a while with a Berkshire Hathaway company, and then went on to get a PhD in finance. And I thought that I was going to end up being in hedge funds or private equity or something like that. And my family, my dad, when I was a little kid, did a lot of real estate development work in a couple of little places called Winter Park and Vail, and a lot of money, and then figured out that you can be rich and not happy. And so they started a foundation and gave all their money away. And out of that seeds of that foundation, my dad was doing economic consulting in Brazil, and his interpreter was a medical student, took him to a clinic, and it just tore his heart out. So he came back and started Project C.U.R.E. in his garage, and ran it for about 10 years. And then he came to me and said, hey, I could use some help. And I was on my way between academics to go back to New York. And I told him I'd help him for 6 months, and I've been doing this for 23 years now. So we ship big 40-foot containers, think semi-truck trailers of medical supplies and equipment all over the world. And on a good month, we will do somewhere around 20 to 25 containers a month. And we worked in 138 countries. We have training that goes along with that. So we do what we call our C.U.R.E. clinics, and we've got a C.U.R.E. college where we're teaching things like helping babies breathe and essential care for every mother and things like that go along with the equipment and the supplies to really do what we refer to as health system strengthening work all over the world.
Amazing. Thank you so much for sharing that. We look forward to your insights. Arick Wierson, you have been in business, and you have been involved in the health policy world. Tell us how you got into this realm and a little bit about your background.
Yeah, thanks, Sosamma. Yeah, I mean, I think the theme is people that have backed into healthcare. I guess I probably backed in the oddest way. I had been living overseas in Africa, in Angola, for about 7 years, and I came back to my native Minnesota and got involved in what was then Minnesota's attempt to bring the World's Fair to this region. And that fair was going to be health and wellness. And while we ended up not getting the bid, we lost actually to Argentina. The people there were some prominent people around the Twin Cities that were very keen on sort of positioning the Twin Cities as this global center of health and healthcare. I mean, here obviously we have the giant companies like Medtronic and the United Health Group, and the Mayo Clinic isn't that far away. There's obviously a very vibrant startup community, Jeff, and Revel being one of them. And so we decided to create what became the Manova Summit. The MA in Manova stands for Medical Alley, which is the trade group that represents all these companies, and Nova meaning innovation. And so I partnered with a longtime former chief marketing officer at General Mills and a woman who's sort of the doyenne of public relations in the Twin Cities. And we basically created this global summit, which is now, I think, basically a must-stop place, or it was up until this year, in terms of the global health conversation. And so that's how I backed into healthcare, very late in life.
Well, thank you for sharing that. And for those that are just listening in, the Global Health Summit that he's referring to, that Manova started, is often referred to as the Davos of the health policy world. And so it's really wonderful that that you were part of that. So, gentlemen, what I want to do is actually get into the topic at hand now and to really talk about health. And when we talk about COVID-19, it's in a broader context of public health. So before we get into the specifics of COVID, we want to go into a broader discussion of public health to set some context. So I'm going to start with you, Jeff. As you are thinking about, public health before COVID-19, what were some of the priorities or biggest concerns that were on your mind for public health prior to COVID?
Yeah, so I think a few things come to mind. One would be health literacy. We have a real problem in the US especially, but I'm sure this is global. It's a very complicated, hard to navigate topic for people. Everything from how do I get the care I want? How do I advocate for myself? How do I understand who's paying what bill? So health literacy is a real issue that I think pre-COVID-19 was there. The second one falls into a bucket that is often referred to as social determinants of health. And the social determinants of health make up a lot of barriers to care. So think about barriers to access food, barriers for shelter, barriers for transportation. So this has been a recent topic, like in the past 3 years, that a lot of companies are really focused on trying to understand what those barriers are. We work mostly in the US, so I don't have the global perspective that Doug probably has, but I'm sure that a lot of those barriers exist around the world. And the third, I think, that is really prevalent, that is a real concern that a lot of people are getting focused on, is mental health. The mental health covers such a gambit of concerns for our healthcare system, and the effects of how we receive care and give care have a real pivot point on mental health that is fairly unaddressed.
Great points. Thank you for sharing that. Doug, I'm going to bring you into the conversation since Jeff already referenced you. When you think about public health prior to COVID-19, what are the key priorities that you've identified as concerns?
Well, pre-COVID, we were doing just a lot of work on, like I said, the system strengthening. So we were going into communities where, maternal mortality might be measured in 4 digits, not 1. And, communities where we might lose, 14, 15, 100,000, as opposed to, my community where I live, it's 4, that number. And the solution sets to that were fairly simple. When you really think about it, it's suture, it's gloves, it's hot water, it's sterilization. It's things that don't seem to be a big issue here. There's some training that goes around that. We do a lot of helping babies breathe training, for example, because you got the 60 seconds, the golden minute, to take care of that little kiddo and get him warmed up and get him breathing. And you can dramatically reduce mortality rates for things like that. And the crazy thing about it was that, pre-COVID, we had so much of the things that were needed over there that we just, we were bad stewards of it. We really didn't take care of those things. So our focus really was on bridging the gap of inequality between what we experience on a day-to-day basis, surplus, and the way the rest of our clients, they work 12 hours a day and they make $1. I know you experienced that living in Angola. That's a tough way to live life, especially, for things like babies. And then you put on top of that something like cancer or now COVID, and you've got a real problem.
Great. Thank you for sharing that. Arick, you have lived and worked both in the United States and overseas, New York, Minnesota, South America, Africa. When you look at all that, what were some of the priorities that you had about public health before COVID-19?
I think I've been always fascinated by the interconnectedness of our health. I think that, in the United States, obviously, since we have such a peculiar way that we pay for healthcare, we tend to think that our issues in the United States are really, germane only to us. But at the end of the day, and we're seeing that now put on COVID-19, that things that happen in other parts of the world repercuss globally. And, there's a metaphor that's not terribly polite, but I'm going to say it anyway. But, it's like you can't have a peeing section of the swimming pool. Everything affects everything else. And I think that at the Manova Summit, we actually had some of these top epidemiologists that you see on the news regularly opining about the government's response to COVID-19 and other matters. And they were all at Manova last year, and we were talking about what if. And this is November of 2019. October of 2019, talking about what if there was this global pandemic, and now we're in the middle of it, and we're seeing that, really how interconnected the whole world is when it comes to these things.
Great, thank you for sharing that. And Chris, you are right in the middle of medical provision, and you've seen everything up front. So now, obviously you stepped away for that, retirement time, but prior to that, when you were thinking about public health and before COVID-19, what were your priorities? What were the things that affected you most as a doctor?
So I guess I would mention three things. First is just access to care. We've had a significant number of uninsured individuals in California. We saw a remarkable decrease in the amount of uninsured following the Affordable Care Act. But with the current administration, we're seeing the numbers of uninsured rising. And of course, we have a lot of undocumented people in California that are really not covered by any organized healthcare system. So access to care is an issue, and access is not just only coverage, but it's actually ability to get care when you need it. A second issue that we focused on is affordability. We spend more on healthcare in the United States than France spends on everything. 18% of our GDP is devoted to healthcare, and quite frankly, the results that we're getting is in the really bottom quartile of the major industrialized nations. So affordability is a major obstacle to care here in the United States. And then the third thing that I would bring up is what Jeff talked about in terms of social determinants of health and health inequities. The more we learned about the social determinants of health, the greater importance that we see these factors play. The majority of one's health is not due to the medical care that they get, but the fact that they have or not have a roof over their head, access to fresh fruits and vegetables, transportation, the ability to pay for the care and services that they need. It's becoming a huge issue. And when we think about fairly large segments of our population, we need to think more broadly in terms of how to provide care for these people. We can have the best health care possible, but if they don't have transportation to get to it, or they can't afford their medications at the pharmacy, it doesn't really provide much value to them. So we need to think about healthcare in a much more broader way than we have in the past.
Excellent. It's interesting. All of you brought up some great insights about public health more broadly. So now let's take those same insights and priorities and apply them to our COVID situation. Now that we have experienced the beginnings, or maybe the middle, we don't know yet where we're at in the duration of COVID-19 and this global pandemic, has any of your priorities or any of these, sort of key points that you mentioned in public health changed at all? Or are there additional ones that you want to add at this point? Doug, I may start with you this time.
Well, I can tell you that it changed dramatically in the last 8 weeks. A couple of things happened, and it was literally almost overnight. The thing that happened was we were not able to get shipping containers. For people who sort of aren't really familiar with the logistics industry, shipping container they use like a grocery cart. You don't own a grocery cart. It just helps you get from the store out to your car. Right. And you don't own the shipping container unless you buy it. So when COVID was happening in Asia, people stopped shipping things to the United States, which meant that there was no shipping containers in the United States. So the same day that we got the news that they were cutting back on port workers and on shipping containers, we got a couple of calls in pretty rapid succession. One was from my younger brother, who's fire chief here in Denver, and they couldn't get a hold of masks and they couldn't get gloves. And then we got some of our volunteers. You know, we'll have around 25,000 volunteers, and a lot of those are nurses and doctors. And they started calling from the hotels saying, or from the hospitals rather, saying, we can't get PPE, we can't get gloves, we can't get gowns, we can't get masks. There's no sanitizer, we're in trouble. And so we pivoted our entire organization 180 degrees, and we went through the warehouse, started pulling out, you know, the gloves and masks and gowns. The irony is that usually when we would ship those containers, people would say, hey, could you leave that stuff off? We don't really need the gloves and masks and gowns. What we really want are the ultrasounds, and we want this, you know, surgical equipment, surgical supplies. Well, all of a sudden, the stuff that everybody had too much of was in short supply. So we started doing drives, and we were working with some of the professional sports teams like the Broncos and the Titans and the Astros, the Cardinals down in Phoenix, and setting up in these huge parking lots, and people from the construction trade and from you know, biology labs at the university, they say, hey, you know, I've got N95s, I've got gloves, I'm not going to use them now. We're not teaching biology lab anymore, so you can have them. And we turned around and we started distributing those to the big hospitals. And now, you know, it's these small hospitals out in these little communities from, you know, the middle of Missouri, Kansas, Illinois, Colorado, Arizona, Tennessee that are saying, you know, we're not aligned with an HCA or a Kaiser or whatever. We can't get the supplies. We're not doing elective surgeries. And so we're going to go, and so we're trying to help keep that part of our organization focused on those people who need it here in the U.S. And we're getting the call ministries of health from everywhere from, you know, Mexico to Nigeria to whatever, saying, you know, the United States, England, France, Spain, Italy, you guys have sucked all of the PPE out of the world supply system. We didn't have money to buy any before. Now there's none to be had, even if you have money. And so we're kind of trying to scramble to figure out what we're going to do about that inequality. That's the next one.
Really interesting, and in such a short period of time, you know, fascinating set of challenges. Arick, I want to ask you the same question. You know, now that COVID has hit and affected the globe, how have those priorities that you mentioned earlier changed, or maybe they haven't changed?
You know, I think that, you know, I look at this from two perspectives. My wife is from Angola, and we're still very much aware and follow things that are happening in Africa. And I actually had my own health scare. I had a very severe case of malaria a number of years ago and almost died in Angola. And, you know, the health systems in developing countries are so precarious to begin with. And then you throw a pandemic like this on top of that. I mean, it's basically crushing these systems if you know, if they have any attack rate that's anywhere near what they're having in the developed world in places like, you know, Italy and Europe and here in the United States. I think that, you know, for me, what has really happened in the media space is that the entire, there's almost no conversation that's happening about any subject anywhere in the media world that doesn't have some link back to COVID-19. And I've never seen a story that has, or a theme that has come across, and since I've been following, you know, the news and the media, that has been that pervasive. And I think that, you know, the joke among journalists right now is that unless the story has COVID or coronavirus in the title, you know, editors aren't interested. And that's certainly true. So I write a lot about politics for CNN, and I do a lot of sort of business and technology and disruption for Observer and a few other publications. And right now, unless it's COVID-19 related, no one cares. And I think that has been sort of a tremendous shift in terms of how we're thinking about the, you know, just how daily life and the massive repercussions that this disease has had in every corner of our existence.
Absolutely. And we're going to talk a little bit more specifically about the media very soon in our broadcast as well. But I really appreciate you referencing that, because you're right, that is a significant impact on how we see priorities. Chris Palkowski, same question for you. Have your priorities shifted since COVID-19, or do you see other changes as a result of this pandemic?
Well, I think all of them have actually gotten heightened by the pandemic. Clearly, the issues of affordability, access, and healthcare inequities are all playing out as this pandemic unfolds. I think a new concern has been the readiness of our country for a pandemic. I think there's been really significant shortfalls in our response, both in terms of leadership and leadership structure, having the necessary organizational infrastructure to support a response. Obviously, issues regarding supply chain and being able to scale to the size of the problem. So there's been a lot of concern there. I think there's a lot of work to be done in the future in improving in our preparedness and readiness.
Great. And Jeff, I'm going to bring you in this conversation too. Same thing, you listed some really key priorities. Have those changed? Have they been heightened, as Chris mentioned, or are there new ones that you want to add to that list post-COVID?
Heightened is maybe an understatement. It feels like everything's turned up to an 11. You know, a bit of good news, there are certain technologies that took a huge leap forward. Telehealth, for example, is the adoption rate of telehealth, where a physician like Chris can sit in his home and consult with patients, unprecedented adoption over the past 90 days. And that's going to be a new integrated into practices, how physicians can meet with patients. Then there's just a whole laundry list of challenges. We talked a little bit about mental health, but think of the sadness and the loneliness and the stress and the emotional exhaustion that people are under. We're starting to see that in our assessments that we do with the Medicare and Medicaid populations. There's a new social determinant of health called the digital divide, and that digital divide is being called the super determinant of health. So the people that are not connected to through a high-speed internet connection, it is a haves and have-nots. More than ever, that is being exacerbated. Access to food is challenging. Domestic abuse and domestic violence and things like that are being exacerbated. Imagine being in a domestic abuse and not being able to go anywhere and being under a stay-at-home order with somebody who's an abuser. Housing, homeless. How do you shelter in place when you're homeless? You know, there's just the list goes on and on and on. So we're seeing all of these in we do a bunch of survey work for these big healthcare plans, and the surveys go out to these different types of members. And so we're just seeing this uptick in all of these flags that have an impact on how they access care. And it's very concerning. And I think the good news is that a lot of Chris's colleagues, as well as others in the healthcare field, are really leaning in. They're all trying to find new ways to solve this. So it's not being unnoticed, and where some of these issues maybe were brushed aside in the past, they're front and center now.
Absolutely. We're going to spend also an additional time talking about some of these unintended consequences, you know, how all of those things that you described, Jeff, are maybe not things that we think about in the context of a global pandemic and yet are very real. If you're just joining us, this is the Health and Justice Forum, and to all of our live audience, we welcome you to this discussion on COVID-19, global pandemics, and public health. We have with us as our panelists, Dr. Chris Palkowski, Jeff Fritz, Dr. Douglas Jackson, and Arick Wierson. We've been talking about public health more broadly and some of the changes and priorities that may have come as a result of COVID-19. If you are interested in sending us a question or comment, please be sure to send those through your question box. And as just a tip and advice for those of you watching, to give you the best audiovisual experience, I would suggest you close your other programs so that you have an opportunity to hear and see our panelists at their best. So with that, let me continue with our questions. You know, now that we are into the topic of COVID-19, there's a word that I have seen everywhere, whether it's in media, whether it's in conversation, and that word is unprecedented. Everyone has described this global pandemic as unprecedented. And as you all know, we've had prior global pandemics, but I'd like to kind of get to the crux of why this one is so unprecedented. Why do we use that term? I'll start with you, Arick, especially since so much of this has been in the media. What makes this particular pandemic so unprecedented?
Well, Well, I'll let, I think there's obviously a number of ways it's unprecedented from a health perspective, and I'll let the other panelists discuss that. They're certainly more qualified to talk about that than I am. I will say this, from my perspective, what makes this disease and this pandemic unprecedented is how it's been politicized. I can almost guarantee that if I know what television station you watch to get your news, I can almost guarantee how you feel about social distancing. The prism through which people are getting media, the way in which they've been centered politically is really driving sort of how they react to it, particularly in this country. And I think that that's really unfortunate that data and science and medicine are many times taking a back seat to to political interests and to the response that we're seeing across the country in some respects is also kind of bringing to life this whole old debate about sort of states' rights versus federalism, and I think that's kind of a really interesting political aspect to this moment in history as well. So I think from my perspective, it's so funny and sad at the same time that people, the data's out there, the science is pretty clear. What the doctors are saying what they know and what they don't know, yet people are still coming to their own conclusions based on sort of where they get their news.
Interesting. Chris Palkowski, when you're talking about the medical world, people are on the front lines of this, and what makes this so unprecedented from the medical community? Oh, I think we have to get your audio.
I have concerns with the word unprecedented because I wouldn't want people to think this is going to be a one and done event. The movement of viruses from wild animals to people is well established. Ebola, West Nile virus, Marburg virus, Lassa virus, on and on. And we can anticipate that these sorts of events will continue to occur in the future. So I think framing this as a one-time event, I'm not sure that's in the best interest of the population. That said, there are things about this that are striking. One is that it's a new virus. It's a mutation of a coronavirus, and the importance of that is that basically nobody has immunity to the virus, and so everyone is susceptible. Unfortunately, the virus appears to be considerably more infectious than influenza, and to be somewhat more lethal than influenza as well, which is causing obviously severe strain on our healthcare system and a lot of suffering amongst many people across the globe.
Great, excellent. Unprecedented. I really appreciate the point that you make about that. This term is used widely, but we need to understand how people are framing it and understanding it, and perhaps even reconsidering it. So thank you for sharing that. Jeff, Fritz, same question for you. When we're using this term and referencing it often, what does that mean for you? Why is this so unprecedented?
Well, certainly not in my lifetime, or maybe a couple lifetimes. So. It's kind of that 100-year flood, or it's a big cataclysmic event. I just keep coming back to the most vulnerable, the high-risk populations in health. They are going to bear the biggest brunt, a disproportionate brunt of the burden of something like this happening. And I think Arick hit it right that the politics around it globally, nationally, we've got to move past in order to start thinking about how do you take care of humanity without the borders of politics being involved. So I don't know. I kind of just think that when I think unprecedented, I don't think I will have witnessed or will witness, I hope, through my lifetime, such an impact to the most vulnerable.
Yeah, very good point. And also, unprecedented can also be viewed not only in terms of the one and done, which, Chris, I think you raised a really important point on that, but it's also this idea that maybe it has never looked like this before. So I want you in perspective that way. Doug Jackson, let's have you share your perspective too. I mean, you shared a story of how quickly things have changed in the context of COVID-19, but how do you view this as being unprecedented, or why do we use that term?
Well, I would agree with Dr. Palkowski that, we've when I first started doing this, we were in the height of the AIDS epidemic, and it was all over the world, but particularly where we were working in some of the developing countries. And I remember going into hospitals, Rwanda, Swaziland, places like that, where you'd have 2 and 3 people in a single cot, and you would see somebody and their knees were swollen up, and it was tuberculosis, and it just, the death on that was just horrible. And I'm the only ONEG guy that can't give blood, because I've been, I was in London during hoof and mouth, and I've been on the front lines at SARS and MERS and H1N1 and avian flu and Ebola. We did a lot of work in Ebola. And so I would agree. I mean, we've got to, this is a dangerous world, and some of the biggest dangers are the things you can't see. And I don't think that this is the last one either. So to that degree, I don't know that this is unprecedented. I do think that the reaction has been unprecedented. They shut the entire world down before. We had some concerns around, H1N1. I remember hospitals staffing up and buying PPE then. Ebola, they certainly did. It didn't really get here. And so 6 months later, they were calling Project Here to come get it and send it someplace else. But I think that the public health reaction has been unprecedented, both at the macro level and at the micro level. At the time, we've had a situation, and I saw this for the first time with Ebola in Sierra Leone and Liberia. All of a sudden, we stopped trusting the people that we needed to trust. I've had 3 people in our organization who have lost family members during this, not necessarily because of coronavirus. I mean, heart issues and things like that, cancer. But there was no way to go to the bedside of the people who were convalescing and dying, because you just didn't trust them. My next neighbors don't want to come over and have a cocktail and talk about the things of the day. So we stand, feet apart in the parking lot, and everybody's wearing masks. And if you walk past somebody on the walking sidewalk, or jog past them on the jogging trail or whatever, they look at you. They, don't want to come anywhere near. And I don't know what that's going to do to the fabric of society. That part is completely unprecedented. And how we put that back, because we have to trust each other at some point. You've got to go to a restaurant and know that the person serving you food is not going to make you sick. Every that the fire department rolls up, they have the assumption that everybody in that house is coronavirus positive. They have to operate that way, and it just does something to your psyche when you treat the entire world as being an overly dangerous place, and we can't trust it.
I really think that's the heart of the matter, for all of us, is that, there have been previous global pandemics. There have been pandemics that have been even more severe in terms of deadliness and that type of thing. I think what is very unusual is what you just described. It's that response for various reasons, the contagion, etc. So it's been interesting to see sort of where that has taken us. And that might lead us a little bit into our next conversation, which is, when you have something like this, and we are dealing with it in a very different way than we've ever done before, there's some things that we do right and some things that we don't do as well. And so I'd like to talk a little bit about that. And I'm going to actually start with Dr. Palkowski for this one. When you think about the front lines, we all have really seen the medical community as our heroes. The nurses, the doctors, the physical assistants, everyone. All those individuals have been incredible, and they've been doing everything they possibly can. However, there are many things that maybe need to be improved, not just in terms of health delivery, but all this other stuff we've talked about. So, Dr. Palkowski, what do you think has gone right, and what do you think we need to improve?
Well, I totally agree that the healthcare professionals have really stood in the gap and have just been really inspiring, as well as the first responders and other essential workers throughout the country. I find their courage and their compassion to be really inspiring. I think a couple of other things that have really gone well. we basically knew nothing about this virus a couple months ago, and the amount of information that's been provided to physicians in real time has just been extraordinary. Every day I've got 3 or 4 emails from professional organizations putting out the newest information. So the spread of information about the virus as people are studying it and getting a sense of it has been really remarkable. I'm also really encouraged by the streamlined approach to creating a vaccine. Now, whether those efforts will prove to be successful or not, we'll have to wait and see. But moving this quickly into phased trials I think is truly remarkable. I think there's also some good news in terms of other countries that have put together really good responses to this pandemic that we can learn from. I'll point out Singapore and South Korea. Both of them have strategy and tactics that they've employed that are making a significant difference. They've been able to scale their testing. They've put in successful means of tracing contacts of people that are infected, and they've been very successful at isolating people that have been exposed or actually infected with the virus. So I think there's some important learnings from other countries that the U.S. can benefit from. And it's interesting, those countries that seem to be doing this well were the countries that were affected by SARS and MERS. So their experiences from those other outbreaks, I think, have informed their public policy, and they were much better prepared than a lot of the rest of the world. Mm-hmm. In terms of areas of improvement, I think there's lots of opportunity for improvement in terms of preparedness. It's really interesting. 3 years ago, the director of the virology lab in Wuhan, China, warned about a potential epidemic. That was 3 years ago. Unfortunately, her warnings were not heeded. And as I mentioned earlier, I think there's a lot of work to do in terms of preparedness, from leadership to infrastructure to having procedures and processes in place, being able to scale a response. I think there's lots and lots of areas that we need to work on.
Mm-hmm. Well, and it's interesting that you talked about the lessons learned. That's one of the things that we hope to achieve even from this conversation is what are the lessons that we can glean thus far from this conversation and from the context that we were experiencing. Jeff, Fritz, same question. When you think about, what's happening around us and, you're working in this sort of innovative world, what is going right and what are things that you think need improvement?
Well, I think we've seen, crisis communication. I think we've seen really awesome examples of crisis communication. We've also seen some not so great crisis communication plans. But the ones that are good, I think that reminds us that a plan and how to communicate with people in a calm and optimistic way or factual way is really reassuring for the general public. Closer to what I do, working with insurance companies, there was a pretty fast, through Medicare, Medicaid, and even commercial insurance, there was a pretty fast response to allowing people to do certain things that they normally can't do with their insurance policy. You could renew your medication for longer periods of time. You could access some out-of-network clinics or hospitals. So the guardrails got spread apart a little bit to allow people to have a little bit more freedom. I don't know if it's enough, but the economic support at any cost was pretty remarkable, coming from the federal government through the states. And then I feel really proud of the folks that are showing grit and innovation. They're just figuring stuff out. Everything from people who are scientists to people who are figuring out how to manufacture a thing or sew a thing or anything. There's just a real, and maybe there's a proud American in me that likes to see the American spirit come through, but it's probably a global phenomenon that I just don't see globally. Things that are improvement, to what Dr. Palkowski was just saying, we got caught flat-footed. I mean, holy cow, the warnings were there. There's been facts there. Maybe we're overly optimistic. I also think we fight better. I think we fight wars better than we fight viruses. So, you know, there's got to be a discussion around how we fund and fill leadership positions that are not just about fighting border wars or political guns wars. There's other things that are bigger threats to the human condition and the climate and the place that we live that hopefully there's a wake-up call here.
Mm-hmm. Great points. Yeah, it is very difficult for us to look at this circumstance and say that we were ready, right? We weren't ready. And so Doug, I'm going to bring you into this conversation too. Given that, what do you think we've done right in this sort of, you know, sudden environment that we're in? And what do you think we need to improve?
Well, it's been heartwarming for me to see the level of community engagement. And somebody had mentioned earlier, you know, they're coming around the healthcare workers, and we did one of those PPE drives, and we were all standing out there. We had these big 4-foot by 4-foot wooden bins, you know, that people would drive by and they would drop off the things. And we were standing there watching, and there was a couple who were elderly, right? And everything would tell you that those people are high at-risk individuals. And they drove up and they had their masks on, and they handed out the window 2 little canisters, bottles, plastic canisters of sanitation wipes. And that was their contribution. And I thought, that's the widow's mite. I mean, everybody is doing the things that they know to do, that they can try to do to you know, back to the war analogy, it reminds me of the stories I heard in the 40s with my grandparents who, you know, my grandma used to draw a line up the back of her leg because she couldn't afford nylon stockings because all the nylon was for the war. And I think that was a good thing. I think the information has been good and bad. We've gotten a lot of really incredible information. Patrick Souchon, you know, got on the LA Times TV from the very beginning, gave probably one of the most articulate descriptions of what was going on with COVID that I've seen to this date. I mean, it was unbelievable. Where do you get that anymore, right? I mean, it's fantastic. But this amount of disinformation has been incredible too. I mean, from you know, the political disinformation on both sides. You know, Arick, you mentioned that, to, you know, models that are predicting anywhere from 80,000 deaths to 2.5 million deaths. And I think when you get the level of disinformation in society, people get skeptical and then they don't believe anything. And that's a problem. That's a big problem. And then the other thing, I think we really have to sit down and have a conversation about a couple of things as a country. One of those is the thing you really need. Is it smart to have it on the other side of the world when you need it today? But I'm not talking about the political discourse between China and the United States. I'm talking about how long does it actually take you in days and weeks to get the things that you need brought to you now, and at what cost? You know, I've heard of you know, 747 cargo planes being chartered for $3 million to fly stuff around the world right now. Craziness. And why is it that we have to throw everything away after the first use? Whether that's masks, gowns. You know, we used to reuse gowns. We used to wash them and clean them and use them again. We used to actually make coffee in a coffee pot. Now we have these little cups that we throw everything away. And I think there's a conversation. Jeff, you mentioned the economic, I mean, the environmental impact. When you go in a hospital, from using 4,000 N95 masks a day to 40,000 masks a day, not only is there a problem sourcing that material, where do you put those 40,000 dirty masks? We're not even talking about that yet. And so I think that there needs to be a lot broader discourse about some of the things that we just take for granted that we get every day.
Really good points. Neil, we were talking earlier about unintended consequences, and that's certainly one of them, the environment, the environmental impacts. And I'd love to sort of spend a little bit more time on that in a moment as well. Arick Wierson, I want to bring you into this conversation as well. So when we're looking at this context and the different things that you've heard from our other panelists, what do you think we're doing well, and what do you think needs improvement in how we're responding and addressing this COVID-19 crisis?
Well, I take a far less charitable view than my esteemed colleagues on this call about how we're doing well. I think that this country, by and large, has been an abysmal failure. I think that at the national level, we've seen gross incompetence. I think that there's been no national procurement strategy for PPE. There's been no national coordination with the governors. There's actually been the opposite, a lot of bickering and name calling and prioritization based on sort of political favors. I don't think that history is going to treat our national leadership, and perhaps you could argue on both sides, but I don't think history is going to treat this moment of American history kindly. I think it's going to look at this as being almost the nadir, I think, of where politics has gotten so off the rails that it's cost people lives and thousands of lives. I think, that on an international cooperation level, I think it's even worse. I mean, we find that right in the middle of a global pandemic, we're suspending funding from the WHO. I mean, it's almost something that if you were to pitch that to a publicist and say, I want to write a book about this, or I want to do a movie script about this, they'd say, that's not believable. That would never happen. And that's exactly what's happening. So I think that what we're finding, though, if anything, if there is a silver lining, even though it maybe has some tarnish on it, that would be that I think we're finding that public health actually matters. And I think there's a renewed understanding that we need to make investments. I mean, while we have an administration that's looking at creating a space force, maybe we should be thinking about creating a virology force or an epidemic force. A new branch of the armed services that's focused on fighting sort of invisible diseases like this. I think that there was a poll that was actually, I think, commissioned by Revel. It was run by Harris. That was really, really fascinating to me. That came out a couple of weeks ago. And Jeff maybe could speak more to that. But one of the things that I thought was really interesting also is that we talk about the second wave of COVID-19 coming in the fall, but there's another wave that's coming, and I'm not exactly sure it's going to come this summer. It might come in the fall, and it's not related to COVID-19 directly. But imagine the next crisis in healthcare is going to be all of these people that because of COVID-19, they haven't been going in to get their dialysis or they haven't been getting their radiation treatment. All these people have this pent-up demand for medical services. And when they say elective services, a lot of people think, oh, he's not getting that nose job or he's not getting his ears pinned back or whatever. No, we're not. Elective means things that you don't necessarily need to do tomorrow, but you should do in the next week or a couple months. And a lot of those people have been pushing off those things because they're afraid to go into medical centers, which are becoming the ground with COVID. And now you're going to find that as these, you're going to find in the next couple of months that there's going to be this onslaught of people going into healthcare centers looking to get this critical treatment, and the system's going to be overwhelmed for completely different reasons. And I think that's going to be another crisis in healthcare that we haven't even begun to discuss.
That's a really important point. Recently there was a report that said that there was fewer heart attacks that are being reported around the country. Now, is that because there's fewer heart attacks happening? Probably not, right? Especially in the midst of this type of stress. It's that they're being reported less because fewer people are taking themselves to the doctors when they need to. And so there's, that's just one example of what you're describing, Arick. And certainly there are a number of others that we could also describe. So with the conversation that we have, I think we're going to transition a little bit to looking at the sort of the wider scope of political, social, and economic. All of you have mentioned on some level that these have all been implicated by COVID-19. There's, political consequences, social and economic consequences, but there's also different views and perspectives from all of those different arenas. So I'd like to kind of get into that a little bit. Jeff, Fritz, I'll start with you. When you think about this sort of range of political, social, economic concerns, and you've mentioned many of them, and now this range of views, what do you think is going to be some of the major challenges in terms of our response, or how has it affected even your work?
Well, the political environment is so toxic that it gets in the way of the greater good. I'm thinking about this Time magazine piece that Mikhail Gorbachev was in. I think it was a week ago or so, and I might get the quote wrong, but he basically said the overriding goal has to be human security. And we need to demilitarize the world affairs and the international politics and political thinking. Until there's some leadership that can move the needle towards not political gamesmanship or brinksmanship around who gets the win or who's going to posture this or that when it comes to our global health. I think we're going to have more of the same. So hopefully this is a wake-up call. I don't know if that answers the question, but that's what comes to mind when I think of the political and social impacts to politics, I guess, in affecting global health.
Mm-hmm. You know, and there are also economic implications that, you know, you work with a lot with these various clients in various, you know, economic conditions. And what do you see is happening in that environment in terms of this COVID-19 crisis and what's affecting people economically?
Well, just looking at the numbers, most states are going to have between a 25 and 35% increase in Medicaid members. And to be Medicaid eligible, you have to be down on your luck. I mean, these are people that have some disabilities, but oftentimes their financial circumstances drive them into Medicaid. At the same time, you've got states entering the worst financial condition they've ever been in. So now you've got a state who's trying to harness a plan that was built for a certain population, and you've got a 30% increase in the population that they're charged with servicing through Medicaid. The math just doesn't work. So how do you rethink that in a politically charged environment when the greater good is not the top of the list to deal with these economic conditions? So those are the things that we're seeing. Thank goodness there are a couple rays of hope. I mean, the Affordable Care Act is there, so there's huge increases in Affordable Care Act enrollees coming out of commercial plans, but even those are underfunded. You know, the cost to stand up the navigators who help people make those selections is not there. So we got to get past the politics really quick in order to solve some of the economic challenges that we're going to have ahead.
Absolutely. Doug Jackson, Project C.U.R.E, like Global Justice, is nonpartisan, and you work with a range of people all over the world. And here we are with this crisis where you have so many different viewpoints on how to do things and all of that. How has that had a bearing on your work, or what do you see as some of the challenges of these diverse opinions?
Well, I live in a state where gratefully I've got an R and a D in the Senate, and they're both working really hard on the COVID thing. And it's been neat because about every week or so we get a briefing from Senator Gardner and from Senator Bennett, and they're both incredibly smart guys and they're working hard. And I just, you know, there's a little bit of that has made me happy that at least there's one small example of a couple of people who can come together and try to figure something out. Yeah. I'm a little less encouraged on a broader scale. You know, we've done work in South Sudan. That was a tragedy. We've been doing a lot of work post-Syria. That was a tragedy. We've been trying to get stuff into Venezuela. That's a tragedy. It's not surprising to me that we're in a situation like this in a global pandemic when people can't figure out what to do, because we got a history of not as a world, as the international community, looking at some really tragic situations and not figuring out what to do with that. Rwanda genocide. I mean, the list goes on and on and on. And typically in the United States, we just don't have to deal with that in our community. And now we did. And so coming out of this, I hope that it engenders a little more conversation. I had a chance to spend some time with Thomas Friedman, author. We were talking about a bunch of this stuff and 9/11 things. And his comment to me was, he said, well, Doug, he said, this all stands for the proposition that if you don't visit the bad neighborhood will visit you. And so for the very first time, I think maybe in the history since World War II, we've had the bad neighborhood visit us, and it's just not very pleasant. And so that's going to engender some other conversation. The problem that I foresee coming is that we're going to have this conversation in a time of what will be hyperinflation. We know that. Who's going to pay for this? I mean, we already spent $3 trillion. We're going to spend another $3 trillion, $6 trillion You lay out $1 a second, it takes 38,000 years to count to 1 trillion. And we just added $6 trillion to it. And so we're going to have to respond, and then we're going to have to pay off all of this stuff. And that's going to be a double whammy for my kids. How do you keep this from happening in the future? How do you get the world to agree on the right course of action, and how do you do it when you're broke?
Mm-hmm. And those are very real and very, immediate concerns. Even when we're in the middle of security and health and all these, wellness concerns, these overarching concerns that you mentioned are also very, very significant. So thank you for sharing that. Arick Wierson, let me bring you into this conversation. You were critical of how well we've been responding as a nation, but with this division that we have and the various perspectives on the political, economic, social concerns, how do we manage that? How do we deal with that? How has that affected your work? Oh, I think we have your audio.
Sorry. What I'm fascinated by in this whole conversation is this sense that how it's affecting different generations. Obviously we know that from a health perspective, the most at risk cohorts are those that are, above 65 or have underlying health conditions. But think about this. There was this piece out this morning on CNN about how it's affecting Generation Z. Generation Z are those that are born after 96, 97. Mm-hmm. And these are kids that some of whom are still at home with their parents, but a lot of them are now, in the workforce or at college. And they're the ones most likely to be going into these service industry jobs, working at restaurants or doing things where there's a lot of social interaction. And mm-hmm. suddenly they're being furloughed, or they're not, those jobs just aren't there anymore. And think about millennials, are a little bit older. That's the generation that already went through the 2008 financial crisis. And this is their second major sort of setback financially as a cohort. Mm-hmm. And so I think that that's going to have some very profound reverberations in terms of their mentality. And this is going to be forming policies and doing the voting and providing the brunt of the votes, going forward in the next, say, 4 to 6 to 8 elections. Mm-hmm. So I think we're going to see how this epidemic has really sort of solidified and cemented some really core principles to this key demographic. And I think that the impact is going to be very wide ranging. I think that we're going to see social policies that are much more expansive than they ever have, maybe since the New Deal. I think we're going to see a real major shift over the next sort of 4 to 10 years, I think, as this generation comes of age and embraces all of their voting power. And there's going to be a tremendous sort of socioeconomic shift in this country in terms of prioritization. I think more immediately what we're going to see in terms of economic impact is, and I'm actually writing a piece about this right now, is called, is this the end of the shared economy, mm-hmm. right? I mean, shared economy was like, the big thing the last 4, 5, 6, 7 years, with companies like Uber and Lyft and Airbnb. But now suddenly the question is, do you really want to share? Because sharing means, in most cases, Airbnb might be a slight exception to that, but in most cases, you're sharing something with someone else in close proximity. And so suddenly those ideas are seen now not only as not good, but sort of dangerous and perhaps even deadly.
What's interesting is many of us have children that are in that Gen Z age group. And so it'll be interesting to see how they're observing and what lessons they take away from this and what kind of society they build when they come of age. It's a fascinating point. Chris Palkowski, let me bring you in on this conversation. Obviously, like many of us that are working in this field, you're working in sort of a nonpartisan way, right? You're working to provide medical care. And yet, political, economic, social concerns weigh, and there's all sorts of different viewpoints on the right way to do things. How has that impacted your work? How do you see these varying views affecting our responses to COVID-19?
Well, putting my leadership hat on, I agree with really Jeff's comment about the political environment. I mean, here with things kind of being overheated, a lot of finger pointing, really not conducive to people coming together cooperatively and working together to create good solutions to our problems. From a social standpoint, I see really major issues with the amount of misinformation and mixed messages that our leaders have provided the population. I think the population must be very confused. based upon all the different messages that they're receiving. And I think that confusion increases the tension created by the health impacts and the economic impacts of the pandemic. And I think with the rise in those tensions, I think we're already beginning to see conflict between different groups of people that have been affected differentially by the virus. Seniors being very, very concerned about their health, as well they should be. Small business people being concerned about their economics, which of course they should be. But that sort of coming together and being concerned about one another, I think has been inhibited by the fact that we really haven't had a coherent strategy or approach towards the pandemic, and there's been so much misinformation that the public couldn't help but be somewhat confused.
Absolutely. I think that's a great lead into our next question, which is really about the role of media and social media. You've all mentioned that there is information, misinformation, differing views on information, and I think it might be worth a conversation about that too. I know several of us have mentioned that part of what makes this unprecedented is the response, and I would include the media response in that. So let's take a moment to sort of dissect that a little bit. I'll start with you, Doug Jackson. When you think about media and social media and kind of the impact both for informing and maybe even causing some misinformation, how do you look at that? How do you think they have been affecting practitioners and others in this response?
Well, I don't know that the media that we are suffering under right now, the misinformation is something that's new. I think that it just was the shock to the system that showed us exactly how badly it's been broken. There's this theory in economics that to have credibility, and it's game theory, you have to actually have an investment where if you don't perform, it costs you something, right? So there's an economic punishment to it. And it used to be that if you had to build a newspaper factory and spend millions and millions and millions of dollars on buying the printing presses and the trucks and paying the people, and you lied, that there was an economic consequence to lying. Now there's not. The five of
I think we lost you, Doug.
Oh, really? Huh. Are we back? Okay. I don't know where in that we lost, but anyway, I think
you were saying something about drinking Clorox.
That's right, exactly, and put a light with it. But I think that at some point we have to get back to this notion that there has to be some metric of believability in the person putting out the disinformation. There has to be some consequence back. And media is so free and so cheap right now that you could say that. You could say anything you want to say, and you can put it up, and somebody's going to believe it. That's a problem. We need to rethink that one.
Absolutely. Arick, Chris, I'm going to bring you in on this conversation. This is your field. You have worked in media for many years. And how do you react to this current climate and environment? And how does media interact with providing information or disinformation and the impact on practitioners? What would you say about that?
Well, it's tough if you're on the side of science and data and so forth. I think it's really tough to see how there has been sort of like this divide where people are somehow skeptical of people that throw around too much science or data, and they think that there's some sort of nefarious agenda. I worked for 10 years for a guy named Mike Bloomberg, who many of your viewers are probably familiar with. He was the mayor of New York for 3 terms and recently had a very short-lived presidential run, but has been a major philanthropist and a major supporter of public health initiatives, not only in this country but around the world. And he's always had this phrase that says, everyone's entitled to their own opinion, but not their own data. And frankly, I think that's kind of what's going on right now, which is, there are a lot of people that are looking at data and they're not believing it, or they're misinterpreting it and using it for their own sort of political ends. And it's really disheartening to see that, because if there's no set standard for what is truth and what is real, then I think we're in a bigger, more serious hole than we might have thought we were just even a few years ago. It's really disheartening.
Well, I'm going to bring Dr. Chris Palkowski into this. Dr. Palkowski, you come from the medical world. It's about science, right? And you use a lot of data and other things to sort of measure what you're doing. How do you respond to what Arick has shared as far as, just this idea that data is being viewed in these different ways based on political, economic, social perspectives?
Yeah, it's been very concerning that the scientists and the physicians who really have the expertise have been largely marginalized, at least at a federal level. I think that the printed media, the major newspapers and the major network TV stations, they reported actually on the science. I thought that they've done a fairly good job. It's the other messaging that mixes into it, the political messaging, the government officials messaging, that I think has really complicated people's understanding of what's going on.
So has media and social media has had an impact directly in how you are able to provide service?
I don't, in terms of the way care is being structured at Kaiser Permanente, I don't believe so. I don't believe that the media has inhibited the care that we've delivered. In fact, I think they've done a fairly good job in terms of talking about how things have changed, how the healthcare systems are making things safer for patients. Encouraging people to seek care if they actually have a heart attack or other serious medical conditions. I think that a lot of the mainstream media actually has been helpful in terms of the care delivery, at least in our area.
Great. Jeff, Fritz, you were talking earlier about all this information that's been getting out, and there's some good things that are happening in that regard. But let's talk about media and social media more broadly. Would you view that in the same vein, or do you have other perspectives on how they've had a bearing on this crisis and how we manage it?
Yeah, we've been trying to study this. So a lot of what we do is behavioral research around how people are receiving or think about care. And one of the phenomena that what I thought was really interesting is there's a faster churning of who the caregiver role is in a family unit, where typically a 65-year-old might be caring for a parent. That is accelerated where those people are supposed to stay home, and now their kids are supposed to be their navigator. And where are they getting most of their information? Non-traditional means of news channels. So we found through our study that social media was the lowest reliable source of information, and yet the folks that were stepping up into caregiver roles, that's their #1 source of information. So that's a real problem. So we tried to help some of our friends that are in provider or insurance company roles, and actually insurance companies got elevated to a higher standard because they're studying a lot of these things, where before people would put insurance companies with used car salesmen. These big insurance companies that are inclusive of integrated care systems like Kaiser or United Healthcare and all those large, they're slightly below a provider like Dr. Palkowski as far as credibility. But if there were a consistent channel of people where people could find consistent information. I remember when I was a kid, we used to get that beep emergency broadcasting right in the middle of your program or your day. It drove you crazy. This was a test of the emergency broadcast system. We don't have that. There isn't a place, and we have all this technology that's omni-channel that I could be getting on my phone, I could be getting on my computer, my iPad, my television. There could be this beep that says, here comes the credible stuff. It might not be sexy, it might not be top rated, but this is where you're going to get it every day. This is where it's going to be consistent. This is where it's going to be the best thinking and the best data. That's where I think we could really do a lot more to have a consistent channel or a consistent voice of facts.
Mm-hmm. It strikes me as you're describing that, you know, when you think about even something like an Amber Alert, if there's alerts, you know, things that can go out that can quickly inform people when there's something of major concern, including, you know, public health concerns. I think that would be very interesting to explore. I want to address our live audience for a moment. We have several people who are listening in on this conversation. We want to thank you for staying with us as we continue through our questions. We also invite you to share your questions. I see that there are some already here, and we will respond to them as best we can before the program is concluded. So thank you. Please be sure to just type in your questions or comments in the question box. So we've covered a lot of ground, and we have talked quite a bit about, you know, sort of the social, the economic, the political, the media, but I want to get down to those that are directly affected by COVID-19. All of us that are on this call right now, none of us have COVID-19, as far as I know, right? And none of us have had to face some of the socioeconomic concerns, as far as I know, that many others have. And as we all know, those that are most vulnerable in our community are going to be most affected by this crisis, like every crisis that happens to us, whether it's women, children, low income, people that are in other marginalized types of areas of our society. So I'd like to get into what I'm going to refer to as unintended consequences, with an emphasis on those vulnerable populations. You've all mentioned some of this earlier, but let's discuss it in a little bit deeper way. I'm going to actually start with Dr. Palkowski for this question. And when you think about fighting this disease and handling or addressing this crisis, what are the unintended consequences that you see from a medical perspective in our society?
So one thing that I think that's come forward that I think may be very helpful in terms of addressing some of the health inequities is the use of telemedicine. You know, this is an area that I think people have been working on for a number of years. I know Kaiser Permanente has for a number of years been offering video visits and telephone visits and so forth. Prior to the outbreak, it was somewhere between 10 and 20% of our total visits. Subsequent to the outbreak, it's now running between 70 and 80% of all visits are taking place via the phone or on video. I think there's a tremendous opportunity to address some of the health inequities that exist. Care can be provided less expensively, more conveniently, quicker, and safely for a large number of conditions. I mean, people do need to come in periodically for a physical exam and for testing, but a lot of primary care can be addressed with, you know, through telemedicine. So I think this is a major opportunity. I think many people are experiencing telemedicine for the very first time during the course of this pandemic, and I don't think they're going to want to go back. Instead of leaving work and driving and parking and back and forth, spending, you know, several hours of their day away from their families or work or what have you, being able just to hop on the phone for a 15-minute appointment with your physician, I think is going to be very attractive. I think people aren't going to want to go back. And in terms of the social and economic barriers that exist, I think this is an area where maybe we can decrease some of those obstacles and barriers to those people that find it very difficult to seek healthcare. The person that has to take 3 different buses to get to the clinic, or thinks about should I pay for the gas to get to the doctor's office, or should I take the money to spend on food for my kids? So this is, I think, a real opportunity that's going to come out of this that I think is going to make things better.
Yep, great. And I could see that also for the elderly and others that, you know, just it's difficult for them to come to the medical clinic. And I think that would be very helpful. Doug Jackson, you know, a lot of what you're doing with Project C.U.R.E. is working with vulnerable populations all over the world, you know, often the most vulnerable. How do you see the unintended consequences of COVID-19?
Well, here in the United States, I mean, we've referred to this a little bit. I know, for example, you know, if you need to get a prostate biopsy right now, it's almost impossible to do. It's very, very difficult to get a colonoscopy. It's very difficult to do a lot of things that could be pretty dangerous fairly quickly. Those kind of things can metastasize quickly. So I think we're probably going to see, on an unintended consequence basis, you're going to see a ramp up of things that probably shouldn't have and wouldn't have happened before. Wholeheartedly agree with Dr. Chris about what he was saying here on the telemedicine stuff. We've talked and played with that, overseas for years and years. This notion that if somebody could read your CAT scan in Australia in the middle of the night, because it's the middle of the daytime there, why would you not do that? Why couldn't you give somebody really great health care in the middle of Ghana out of a suitcase and get somebody in London to read it? There's a lot of things like that we can do. And this has been pretty fun because it's really focused this in on, we don't like to change, right? People just don't like to do a lot of change until you have to. And now we have to. And so we're learning new things like this conference right now. It's a fun thing. We would have had a difficult time, everybody getting on an airplane and coming to do this in person. We can do this, and we can do another one tomorrow in a whole different city. Very cool stuff. And those are the things that I think are going to come out of this that are good. The other thing that's encouraging to me as an unintended consequence is really the focus on your individual responsibility for your individual health. I'm seeing this, going outside, going to the store. I'm going to wash my hands. I'm going to take care of my own health. I'm going to take care of my vitamins, build up my immune system. I mean, Kaiser, you guys have been doing preventative medicine for years and years and have been doing a really great job of it. When I was working in Cuba, that was one of the great things that I took away was Castro didn't have any money. So he had to prevent people from coming to the hospital by trying to advocate you to take personal responsibility and keep yourself healthy. The rules that we've come up with around COVID are equally as efficacious as they are for the flu and the common cold and all of those kind of. Wash your hands. Don't get to people. If you're sick, stay home. That's just good public health. And I think this has been a really inopportune time to have to learn it, but the lesson has been good.
I think I agree with you. It's really interesting how some basic lessons, that you think we would already have known are actually really coming to light and have become front and center. Something as basic as washing your hands after, a public contact or if you're ill. So all of that I think will be very useful, and it's interesting to see that there's some positive unintended consequences coming out of this too. Arick Wierson, let me bring you into this conversation. So when we talk about unintended consequences, particularly for vulnerable populations, what is your take on that? What do you see as some of those consequences out of COVID-19 thus far?
Well, in terms of unintended consequences, I will spare you my toilet paper jokes.
Please do.
I think that the thing that's on my mind is really how is this going to affect urban planning? I think that, for so many years, the emphasis among a lot of people was where cities and high density populations is where the action is. It's where the most opportunity is from an economic perspective. And I think that we're rethinking a lot of that. And I think, to Doug's point about, some of the more vulnerable populations around the world, whether it's the favelas in Brazil, towns, in India, or the musekis in Angola, where people live basically on top of one another, these are the most vulnerable populations. And I wonder whether urban planning is going to have to reinvent itself to take into consideration the fact that just because of the pervasive nature of some of these pandemics, and I agree with Dr. Chris that this isn't going to be the last one for a while. There could very well be a COVID-21 or a COVID-23 or something else. I think that we're going to have to really sort of rethink that aspect of it. Another key thing that's on my mind when I think about unintended consequences is you don't hear anyone talking about global warming. The number one issue that people were talking about for the last 5 years in terms of a national and global conversation, you hear very little about that. That's because this pandemic has sort of buried that issue. And I think that, because of the pandemic, there are a number of issues that are going to naturally dovetail into the global warming conversation. For example, mass public transportation, which has, been one of the things that the global warming community has been sort of, advocating for in this country, and certainly other places in the world, particularly in Europe and in Asia. They're far more advanced than they are in the United States. But, I don't know how many people are going to be really, advocating to get on crowded buses or trains, going forward. I think that the same thing goes for another unintended consequences has been, screen time. People are spending so much more time on their screens, and I think we're just at the sort of foothills of trying to understand what are the repercussions of all this screen time and this exposure to toxic blue light that's coming from these screens. I think that there's just a panoply of unintended consequences, and we can't even grasp, how much life is going to change after post-COVID. And people will talk about, I can't wait till we go back to normal. I don't think there is going to be a back to normal. There's a term in economics and physics, hysteresis, which is when you're on a track and you get off that and then you can't get back on it. You're on a completely new path. And I think that's exactly where we are. I don't think there's not going to be a new normal. It's going to be a completely new environment when we go on the other side of this.
Yeah, I agree with you. It's interesting. Well, there will be a new normal, right? But it may not be the old normal. And that is something that I think we all have to be prepared for. And there's really interesting insights that you shared in terms of the urban planning conversation for sure. I do think it's not a surprise that places like New York City or other major cities have been such hard hit because of some of the dynamics that you see in a major urban center versus a rural environment. Even in places like Colorado, we've had very limited exposure compared to what we see on the East Coast, for example. I want to bring Jeff Fritz into this conversation too. Jeff, you mentioned earlier, things like domestic abuse, low-income communities that are really struggling, people who are homeless. These are all lists of people in the vulnerable category that have unintended consequences of COVID-19 that we wouldn't necessarily expect when we say, shelter in place or, safe at home. So would you come back to that a little bit and talk a little bit further about what you see as unintended consequences, particularly for these vulnerable populations?
Sure. So, yeah, like take homelessness. I think this is homelessness reinforced. It's hard to see high altruism around helping people find a roof over their head for the night. It's hard to see how the renters and the gig economy can expand when it's probably contracting in a market way. I think if I were to put one thing forward, I think it connects all of those, and it's this digital separation as well. So, I can only get telehealth, and the most needy who could probably benefit from it might not be connected. And so think about the economics behind telehealth. Just recently, there was a flip over where Chris can probably speak to it better than I can, but you used to, every time you go to the doctor, in order for somebody to code to be reimbursed, you had to get your blood pressure, your height, your weight, and they kind of had to check a bunch of lists in order to code that this was an office visit. Well, now there's a code for a telehealth visit, and they're not going to have you stand up against the wall and check your height, or you're not going to step on your scale, but they're going to get right to the issue. And so I think the dollars backing some kind of telehealth, coupled with maybe dollars backing access to a digital channel for folks that normally don't have a digital channel, could be something that opens up things for people that are having a housing crisis, people that are having a food crisis. Interestingly enough, the rural economy is getting 2 times the stress on when something does bad happen, because they're further away from everything. Connection to the rest of the world that is largely more accessible in an urban population. So there's just a lot going on between housing, food, domestic status, domestic violence, unemployment. All of those things are. So I'm trying to if I were to cut to one thing that I could say, could we really markedly change for purposes like this, not to promote more screen time, to Arick's point, but to have people connected to alternative ways to access care. I think that the digital one is the one I'm thinking of most.
Yeah, excellent. And I would add that for other things like education, even, when you think about children who are now having to do distance learning, what if you don't have the computer and the other kinds of connectivities at home? How do you stay up to date on your education? So very similar trends in some other fields as well. I'm going to have us spend a little time talking about mental health. That's been a real major concern for many, and some of the questions that have come in have addressed that. We're in a place where we are quarantined, we're separated from people. We are, using screen time when we can, but that's, very limited in terms of personal connection. We are often, many people are away from their jobs or have lost their jobs. There's a lot of concern of what their futures will look like. So when we talked about what the new normal would be, what is the new normal for us when we're talking about things like mental health and supports? I'd like to address that a little bit too. I'll start with you, Doug Jackson. When you think about this issue of mental health, how do we process this in this age of COVID-19? He's just working on his audio. We'll come back to you, Doug, while you work on that, and maybe start with Arick unless Doug's back online. You back online, Doug? Okay, Arick, why don't we start with you and we'll come back to Doug. So same question, mental health and COVID-19. What is the new normal that we can expect?
Yeah, so I really think that you see that there's been, and we talked a lot about, or I didn't, but others on the panel have talked a lot about the rise of telemedicine and telehealth jumping ahead, 25 years in some cases in just the last two or 3 or 4 months. But I think that, as what you're finding is that it's, when it comes to mental health and sort of online CBT, cognitive behavioral therapy, and other tools that have always been there, but are now suddenly the go-to part of the survival kit for a lot of people. I think you're going to see sort of a renaissance, if you will, in terms of that section of telehealth and telemedicine. I got to tell you, from my perspective, I'm certainly, people ask me, how are you doing during the quarantine? And certainly it's not ideal, but I have, a good job and a healthy family, and we're not affected by, we're not affected by the coronavirus, knock on wood yet. But, even for someone like myself, it's tough, like, running in between meetings, and then I've got to get my kindergartner on his seesaw on his iPad to make sure he's, doing his numbers and his letters. And then my 15-year-old suddenly, who's never asked me for inputs because she's been at school, comes in and she wants me to help, write an essay about Romeo and Juliet, or Lord of the Flies, which Lord of the Flies is much better than Romeo and Juliet, if you ask my opinion. But anyway, so suddenly you're juggling all of these things at once, and it is taxing. At the end of the day, I find myself much more exhausted than I ever was before, and I'm, and the tendency also is, when in my profession, I spend a lot of time going to meetings and going to meet people, and that time in the car, although you might be listening to the radio or talking on the phone, that's time that you're kind of decompressing. And now when you're at home, you're basically on all the time. And so I think that across the board, independent of sort of socioeconomic status, I think people are really finding that there are some real significant challenges when it comes to mental health.
Yeah, absolutely. And I think that, you raised some really practical points about just what it means for us to have to juggle so many things from home, taking care of the kids and taking care of our work. And, it is a certain kind of taxing that we didn't experience before. I'm going to also bring Chris Palkowski into this conversation, especially from the medical side. When you're dealing with mental health, there's a lot of different considerations, but in this present context, which is so unusual, what are some of the comments that you'd make about, where we need to go with mental health? What the new norm might be after COVID-19.
I think I'm on now. I think it's going to be really important to be able to expand access to mental health services. I think that's really going to be a first step. There's actually a shortage of mental health workers, so we're going to have to be very creative about providing enough access for people. There's just an enormous number of stresses that people are experiencing now, in addition to isolation, concerns about their health, concerns about their businesses and their incomes, concerns about their family members. All of these stresses are going to bring out all underlying mental health issues. And we need to be able to support these people with adequate access to services. I think those sort of can certainly be augmented through telemedicine. I think we've got to look at more creative ways to provide enough care for people, whether that be through group visits, through online sorts of support services, as well as the traditional one-on-one sorts of doctor or office visits.
Yeah, I would add, interestingly, when we talk about mental health, there's so many elements. So it could mean, the medical and health profession providing counseling and supports, but it also could be community-based, even churches and other groups that can provide different types of supports. I think is also important to include in this conversation. Jeff, Fritz, I'm going to have you also comment on this, and then we'll come back to you, Doug, to be able to address this as well. Jeff, Fritz, you brought up this issue of mental health earlier. How do you see the new norm when we're talking about mental health?
Yeah, it's. I hope there's more. I hope there's some solutions coming. I don't know if it's more technology-based delivery systems like Arick was talking about, or broader awareness and training, cross-training within the medical practices out there today to help with this. I think about it in the business that we're in. We do a lot of work with seniors who suffer from just loneliness and depression, and how the impact of that on the rest of their health is remarkable. It's just remarkable. So you put that into the COVID-19 context. You've got these essential workers. If you're a nurse or you're a delivery person, not only are you in a depressing, sad, scary environment all day, but then you're told not to go home and be with your family, quarantine yourself. And so, and it cuts across some a very broad swath of capabilities. There's people who can go to a second home or an apartment, but then there's others who just can't do that, and they're finding themselves in a real dire situation as a result of the heroics. The third thing I'm thinking about is the children. Every time I've talked to a coach or a counselor or a psychiatrist for my benefit, they always want to go back to my childhood. There are some formative things around our mental condition that are based in our childhood experience. And so think of all of these children who are going through this, and we don't even know what the effect is going to be on them and their lives, and how they think about life and confidence, and how they'll be able to manage. So it's got to be elevated to a much higher standard of how we deliver healthcare in the United States and in the world, quite frankly.
Absolutely. Doug Jackson, coming back to you now. When we talk about this issue of mental health, I know in the advocacy world, there's a lot of burnout, and in the medical world, we're certainly seeing that burnout as well. How do you see this health issue post-COVID-19 looking, when we have so many people under such extreme circumstances or very unusual circumstances?
Well, I think one of the things, I do have colleagues and friends who have come out of experience with COVID, and they're better now physically, but there's a sort of a PTSD component to it. Jeff, I think you're right. I think that's the case for the nurses and doctors that I know that have gone through having to make PPE out of trash bags and things like that. There's an element of that, but I think that's going to be pervasive in society. I've got 3 daughters. One is 17, missed her high school graduation. That's going to have an impact. The other one is 20. She was in Spain. This whole thing launched doing her semester abroad. And the other one is 22 and just got her first job with Pandora in Manhattan. And I mean, all 3 of them are going to experience this completely different, and there will be some sort of an effort, mental effort to try to get past that. I got done with one of these days like today where, we did a few of these Zoom calls, and I went back to, psychology class at the university. And I got to thinking about those studies that they had done with the little monkeys, and the monkeys that didn't get hugged developed all kinds of physical problems just for the fact that they weren't touching. And I started this conversation referring to the loss of trust among society. The fact that I just can't go next door and have a beer with my next door neighbor anymore. I feel funny about my brother. I told you, as a firefighter, he won't go see my parents right now. They'll drop off food and they'll wave. The colleagues who have lost parents and have had to sit and watch through the glass. And I think that will be very telling on society, not just for the healthcare workers, but for all of us who have lost those things that we need. Not just because we're not going to have the hugs, but because there's no example in all of history about, maybe going back to the Great Wars, I don't know, where the universe that we know experiences a sense of loss. And how do you deal with that? There's always been a place to go. You could always go to the beach maybe and relax. Can't now.
Yeah.
What do you think about that?
Well, and you touch on something so important, the term grief. Even if you're not suffering with great, mental health issues, everyone is experiencing some level of grief in this context, in different ways, in different manifestations. And I think that's an important part for us to keep in mind. I think it's important, and maybe you'll all agree, that, the oddities that we see in this COVID-19 context are not things that we need to necessarily continue. That's something that we have to kind of keep in mind. What is it that we need to keep for our safety and health? And what is it that we need to move beyond to be able to have the broader, mental health and societal health? And I think those will be interesting conversations. We are getting close to the end of our time together. So I want to get us sort of in a wrap-up conversation about some lessons learned. As we know, we're in the middle of things, and it's really hard in the middle of things to know exactly what we're dealing with or what things will look like later. We're, sort of guessing from our best perspectives. But I'd like to kind of do a little round with all of you to talk about sort of lessons learned, thus far. We are about 2 months plus into our COVID-19 experience in the United States, where we've had shelter in place or stay at home or safe at home orders. And now that we've gotten to this point, what are the things that you're saying are the lessons, are the changes that we need to keep in mind, are the good things that we need to take going forward? I'll actually start with you, Doug Jackson, since we didn't get to start with you last time, and then we'll work way around.
I think a couple of things. This experience, for me anyway, has been an opportunity to walk through a crazy, crazy time with a really incredible group of people, and that would be the folks that I work with at Project C.U.R.E. And some of the lessons that I've learned through that, we spent a lot of time the last 18 months really working on our internal culture. And one of the lessons learned, well, this is true for your family, for your organization, your government. When you know what true north is and you're aligned on what true north really is, what your value systems, it makes the really difficult decisions a lot easier to make. They're still hard. But, for us to pivot, and this is just my personal experience, but for us to pivot 180 degrees and go in an entirely different direction, basically within 2 days, was a pretty remarkable thing for a multi-million-dollar organization. Absolutely. And the only thing that happened was because we were aligned. Some of the stuff that we've done in politics right now is happening because there are some people whose agenda are different than other people's, and they are not aligned. So somebody on the panel talked about, we really need to focus in on humanity. If that's what our true north is, that's what matters most of anything else, then some of the rest of the stuff isn't important. Whether you win elections, whether you look good, whether you get more money, whether you do this, that, whatever. Some of that stuff then goes by the wayside because of the alignment. And I'm more convicted now than ever about the need to align our families, align ourselves as individuals as to what our personal true north is, align our government. What does good really look like? And then I think the other thing, the takeaway for me, has just been over communicate. I spent some time with a fellow named General G.L.O.B.A.L when he was head of Northcom. And I said, so how often do you have to communicate? And he said, when you are sick of saying it, you know you've just started. And I just think that that's been a very, very important thing in this whole deal, is how much do you send that message? And if you think you've done it enough, you're probably not there yet.
Mm-hmm. Great insights. It's interesting. I think COVID-19 has served as a bit of a filter, hasn't it? It filtered out the things that maybe weren't so important, that we put such high priority on before, and then now focusing on the more important things. Arick Wierson, same question for you. Thus far, what do you see as the lessons learned nationally, globally, on this issue?
Well, I'll start personally, and then I'll go maybe nationally and then globally. I mean, on a personal level, I think one thing, and I know Sosamma, you would appreciate this. Every Wednesday at 7 o'clock Eastern, 6 o'clock Central, there is a conference call with all of my best friends from Georgetown. I know that's your alma mater as well. And sometimes there's 20 of us, sometimes it's only about 10, but what's really amazing is that never ever before in the 25 odd years since we've been out of college, and we all gotten together on a phone call or even in the physical location. And so one of the silver linings of this whole thing is that we are all sort of restricted in terms of mobility, and that's enabled us to put really sort of community gathering events like that together, and it's been really, really fun to see that. But I think that on another note that I think is related to your bigger question is I think that there's this perception that I've realized that a lot of people, as the economies are starting to reopen, some more swiftly than others, some of them perhaps too swiftly. A lot of people are saying, well, we've been doing all this social distancing, and yet the numbers are still growing in terms of the attack rate and the death rate and so on and so forth. A lot of people didn't really understand the purpose of social distancing. The purpose of sheltering in place was not to cure COVID-19. It was to allow the medical and hospital infrastructure time to get ready to be able to deal with this. And a lot of people just didn't, seemingly intelligent people that, and even people that get their news from reliable sources, didn't really understand that. There's really not going to be a cure until there's a vaccine, and that could be anywhere from 12 to 18 months or even longer. And I think that there are some fundamental sort of misnomers out there that still have to be addressed, I think, and I wish there was more leadership at the top of this country and that sort of a national crisis communication coming from the White House that could more sort of adroitly address some of these issues. But at the end of the day, I think that we are heading into a new environment. I think a lot of social norms are going to be changing. I think that distance, physical distance, is going to take a long time, if ever, to recuperate. I think that we're in the business of putting people together, whether it's movie theaters or restaurants or entertainment, sports events. I think they're in for a really tough slog. So I think that we're going to see some real fundamental shifts in the way we do business. I think travel, people are starting to realize things that, maybe all that travel isn't necessary. Maybe I don't need to be on a plane going to Asia, every month to go meet with my suppliers. I think a lot of people are reevaluating a lot of things, and we're going to come out of this with a very completely different sort of view on just about every aspect of our lives, both business and professional.
Interestingly, we know sometimes these terms can be problematic. We talked about earlier how unprecedented can be problematic in the way that people view that term. I think social distancing can also be problematic because it's really not the social part that we're distancing, right? It's the physical distancing. It's being able to keep ourselves safe, from exposure. But that can also raise some other things for the future about what does that look like, in general, travel being a very significant one. What does travel look like? We can't all fit like sardines anymore into an airplane, right? We have to approach it differently. So it'll be really interesting to see how that plays out. Jeff, Fritz, I'm going to ask you the same question. Lessons learned so far. There's many other things that we may pick up along the way. What do you think are the critical lessons that we've learned to date and can apply?
I like the way Arick put it. Personally, I have experienced similar. I found myself connecting with people on a regular basis that I haven't connected with, and that's kind of remarkable. And I'm finding my 78-year-old parents connecting with 80-year-old friends of theirs via Zoom. They never did that before. And they're doing it, they're having coffee talk with relatives across the country or across the globe that they weren't doing before. So there is a silver lining to, we've broken some social norms of what it means to be connecting with people, and by introducing or accelerating some of these new ways of connecting. From a global standpoint, I am probably the least qualified to answer it, but I do think that if there were a reliable hub source of information that could be accessed across multiple channels, I think that would be welcomed by people. I mean, I bet all of us have gone to your search engine and you start typing in, I want to know about this, and you get these results and you're like, which one should I choose? You know, which one's going to display this information that I want? Which one's going to answer a question that I have? And so there really isn't a good hub or source of information. And I hope that there's a little more power put into something like the UN General Assembly or the World Health Organization to help coordinate us better across the globe. And you know, for countries like the United States, I hope there's more alignment to that. And for countries like Angola that just come from a different place and capability, that they can find a way to align to those things too. And there's a higher power that can help the whole world cope and deal with something like this in the future.
Thank you, Jeff. And Chris Palkowski, I'll give you this last word on the lessons learned. So when we think about what we've experienced thus far, especially in the medical community, but beyond, what are those lessons that you've seen from experiencing COVID-19 in our society?
Well, Sosamma, I think one of the lessons that I've learned is that we can do better than this. We have the capability of blunting the response of a future pandemic if we learn from our problems that we've had with this one. I think it's very analogous to a fire. And one of the things that you need with a fire is you need a functioning smoke alarm. Similarly, we need to have systems in place that when there's a pandemic, that it's communicated effectively. Secondly, you need a fire department. When the alarm goes off, there needs to be somebody there to respond to the alarm. So we need to increase the capacity, both in our country and globally, to be able to respond to such an alarm. We need to have capable people that are able to respond in a timely fashion, because just like a fire, it's easier to put out when it's small than when it's very, very large. Third, the fire department has to be well resourced. The fire department needs to have trucks and hoses and ladders, and et cetera. And similarly, we need to have the resources available to respond to a pandemic. We need to be able to test. We need to be able to trace and to track, and we need to have the ability to isolate. Finally, we need the ability to be able to scale to the size of the fire. Just like fire departments, they have different alarms for different fires. Similarly, we need to have a similar structure in place for pandemics, where we've thought through in advance the issues about supply chain and resources, such that we're not making things up as we go. Which brings me to the last point, is that there's a science to putting out fires. There are systems and processes that are in place, and we need to have those same sorts of playbooks, those systems and processes, and we need to practice those in advance of the next pandemic, so that next time we're far more ready and prepared than we were this time.
Great. Panelists, you've all shared so many great insights, and I just want to leave our audience with a few themes that you may have heard throughout our broadcast. One of the themes being this idea of connectivity and communication being such a high priority in that connectivity. The other is creating structures and systems for responses, effective responses, and being able to be prepared when we see the next crisis, which we all agree is inevitable, right? We also have talked about being aware and alert to vulnerable populations and the unintended consequences of various types of health crises and health responses. We agreed also to this idea that we need to work collectively and together and avoid partisan divides when we're dealing with something of such a magnitude and scale. These are just some of the themes that we covered today in our conversation, and I want to thank you all for bringing your expertise and your insights into this conversation. To our live audience, we want to thank you so much for participating today. Thank you for your questions and thank you for your interest in our conversation. As we shared at the beginning of this broadcast, we will be providing a video presentation of this conversation on our website at www.globaljusticeonline.org. But we also want to let you know that this conversation continues through writings, through commentaries, through other video conferences in the future. And so we look forward to engaging with you on that as well. In addition, we just want to share with you that each of these organizations that are represented by our panelists are doing remarkable work in various ways, and we encourage you to lean in to what they're doing, and we'll be sure to share through Global Justice website and social media about their updates. Thank you, Dr. Chris Palkowski, who was with us, retired now, but formerly the Physician-in-Chief of Kaiser Permanente. We want to thank Jeff Fritz, CEO of Revel Health. And we also want to thank Dr. Douglas Jackson, CEO of Project C.U.R.E. And finally, Arick Wierson, partner of Manova and founder of the Global Health Summit. Thank you so much, panelists, for your time and your attention, and we continue this dialogue soon. To all of you watching, thank you for being with us.